Hello, my name is Sharina Simpson Smith, and today we are going to view a workshop together. Thank you so much for joining me. The name of the workshop is Understanding Doulas, the Role, Importance, and Benefits in Labor and Postpartum Care. So, just to give you some information about myself, my name is Sharina Smith. I'm a graduate from the University of North Carolina at Charlotte. I graduated in 1997 with a bachelor's degree in social work. I also went back to school for my master's, where I received a master's degree in social work from the University of South Carolina at Columbia. I received that degree in 2002. I am a maternal health clinician. So, when we think of a maternal health clinician, the majority of my caseload, as it relates to where I work at, which is Journeys Counseling Center, and I also work at Journeys Counseling Educational Services, who is hosting this workshop today. But at Journeys Counseling Center, I am a mental health clinician slash maternal health clinician. What that means is I work mostly with women that have different types of concerns as it relates to maternal health. So with that being said, strictly women, and the majority of my caseload are women that have delivered had delivered kids, have had kids, or women that are pregnant. I am a doula, and I have been with Doula International now for over 12 years. Doula International is an agency that provides accreditation for doulas. So I had to go through significant training where I was able to receive my certification to be a doula. I am also a hypnotherapist. So basically, with hypnosis, what I do is I work a lot with the subconscious. The subconscious is a place where we store a whole lot of information. Consumers come and see me for hypnotherapy due to the fact that at times they can't recall their trauma, and I can go into the subconscious, and we utilize the five senses: what you see, hear, feel, taste, and smell. As a clinician, if I'm able to do that with you, then we will be able to go back to the specific date that you have been traumatized, who was there, how you felt, what are some of the things you see, feel, and taste. So I use the five senses to help people recall trauma that they cannot remember. And also, some people come to receive hypnotherapy in order to learn different types of techniques as it relates to how to relax. I do help women that are pregnant prepare for birth. I assist them with utilizing their mind. And if we can get the mind to work with the body, the baby will fall in line as it relates to you taking control of your body and doing what you need to do to help the baby come here. So with hypnosis, we really utilize the mind a lot to work in conjunction with the body to do what it needs to do as it relates to getting your baby here. I am also a trauma-focused clinician. So as a trauma-focused clinician, I also work with women and other professionals as it relates to recognizing trauma and moving through trauma. I express to people all the time, trauma is like a ghost. If you don't deal with it, it will continue to haunt you along the way within life. Trauma will show up within your relationships. Trauma will show up within your jobs. Trauma will show up within yourself. And trauma shows up when you're in the process of giving birth and after birth if you don't deal with it. Trauma focused clinician is a 13 to 16-week session where we will provide you with different types of interventions to bring closure to trauma. So that is a little bit of information about myself as it relates to me providing you information about the roles of doulas today. So, when we think of what is a doula, what comes to mind as it relates to what is a doula? A doula is a trained professional who provides physical, emotional information and support to birthing individuals. We do it before, during, and after childbirth. This role is very, very important in helping making sure that your childbirth experience for you and your family members are or is good. So we play a significant role as it relates to being by women's side and also supporting the family during this life event. Because what we want to take place is for you to have a very, very wonderful experience. Now, there are times when things come up, but having support during that time period can help you navigate through the things that may come up during birth in a better and healthy manner. So, there are two types of doulas that I'm going to talk about today. The first one is birth doulas, which I am a birth doula. And birth doulas are trained professionals who offer emotional support to birthing people, to people that are giving birth, or to persons that are giving birth, and their partners before, during, and after childbirth. So, once again, we are trained professionals who offer emotional support, and also we offer information to the person that's giving birth, their partners, and any other people that you would like to be in that circle during that time and after childbirth. There's another type of doula called postpartum doula. And postpartum doulas are trained professionals who support new mothers and families in the weeks and months after giving birth. Now, I am a postpartum trained mental health clinician too, because as a postpartum trained mental health clinician, I help consumers and families and other professionals recognize some of the things that may come up after birth. And I help as it relates to navigating through that mental aspect of the things that may come up after birth to help the women move along with healthy mental health. But postpartum doulas, they provide they provide mental support and they also provide physical support during that time period. Now, the postpartum doulas may not be mental health professionals, but they provide assistance as it relates to helping you with the baby. They also can provide you with affirmations and assurance as it relates to you navigating through that after birth process. Now, when it comes to doula's role in labor, as it relates to our role in labor, our role is to provide continuous support during that process. We will be with you as you navigate through that process. Now, mind you, we will schedule visits with you before the birth so you can get to know us. It's very, very important that you have a relationship with your doula where you feel comfortable with her or him, hopefully her, I mean, with her or him, because hopefully what we would like to see happening is that we want you to feel like you can be your true authentic self during that process. So we want you to feel relax as much as possible because that is greatly needed as it relates to you moving through the process. We don't want you to feel like you do not trust your doula because that will affect your mental when it comes to navigating through the birthing process. So we want to, as doulas, have a good relationship with you and your family regarding this process. During this time period, we will assist with comfort measures as it relates to we help with your breathing. We also help with your position. Before you get into labor, hopefully before that time comes, we would have tried certain types of methods or interventions that you feel as the mom is very comfortable for you as it relates to you going through the process. It may be rubbing your body. It may be sitting on a ball. It may be swinging your legs on the bed that you're in. It may be it's just so many type of comfort measures that we're hoping by at this time while you're in labor, we have went through these comfort measures and we know what is it that you need, or we have a good relationship with you where you can feel very comfortable with us regarding telling us what you need. Also, as a doula, our role is to offer reassurance and emotional support. We are wanting to make sure, once again, that this is a very comfortable experience for you. So, we are there to offer you emotional support. We are there to encourage you along the way. Once again, we want this experience to be as positive and as comfortable as possible based upon our means and what we could do regarding helping you at this present time. Also, another role during this time period that we play is an advocate. So we're there to advocate for you and your family as it relates to what your preferences are. So when you cannot speak, or if you have concerns, or if we have concerns, we are there to work with you with these concerns where we can advocate for you. We're working together to advocate once again to ensure that you have a real good experience. So that advocating could be, making sure that whenever you work with the nurses and the professionals in the hospital, that we are communicating effectively to them as it relates to what your needs are. And we don't want to overstep the professional's boundaries, a professional role as it relates to nurses and doctors. So we will advocate for you as it relates to ensuring that they hear what your needs and what your wants are. But we cannot tell the professionals what to do because that's not our role. Our main thing is to advocate and to help you. So why doula support matters? Well, doula support matters because studies show that it reduces the medical interventions that are times that are needed or required before we get there, before we get to the point of delivery. So if you have a doula and you all have practiced different types of breathing techniques, you have practiced how to manage pain, then there are times when if you receive support before the delivery, it may help to the point where a C-section is not needed or medication is not needed because you and your doula have spent time as it relates to really learning how to use different types of coping mechanisms and different types of events as it relates to stress and pain. But once again, we do not override what the medical professionals say because that is not our role. But the more time we spend together, the more time you get to know your body, the more time that we are effectively communicating with each other, then that can help reduce different types of medical interventions once you um, enter into the hospital. The next reason why doula support matters is it increases the likelihood of a positive birth experience. That is the ultimate goal as it relates to having a doula. We want to ensure that you and the family have a positive birth experience. Also, it helps reduce stress and anxiety for the birthing person and family. As a doula, we are there for the patient and the family. And we know at this time period, the patient and family is so excited, but also they may be afraid. They may have anxiety as it relates to being in this environment. As a doula, we are there or here to help relieve some of that stress and anxiety where we could be. You can see us as the middleman or the middle person that can help as it relates to communicating information as it relates to what's going on, and also taking pressure off the mom, taking pressure off the family as it relates to the stress and anxiety that may be going on during this time period. And we have to realize that some of the stress and the anxiety is natural because this is something new. And sometimes when it comes to new and unknown situations, people may become anxious or worried because of the unknown. But having a doula there can help as it relates to reducing that stress and anxiety. For example, the doula can help the mom so the dad can, relax and get himself together as it relates to preparing for the birth because the doula is right there with the mom or with his wife or with his girlfriend or with his partner. So that can allow the father or the other partner to feel much comfortable with regulating their emotions during this time period. The benefits of doula support: shorter labor duration. Once again, you have a wonderful relationship with your doula. You and the doula have practiced different types of birthing techniques. You and the doula have just connected to the point where you all have a strong bond where we're gonna do this. We got each other, and the main goal is to get the baby here. So if we have our mind made up together and we're in this together, we can go through the process, and maybe it won't take as long as it would if you're centered around strangers. Lower rates of epidural use and cesarean sections. So basically, once again, you and your doula, we have talked about pain. We've talked about how to utilize our mind to help our body work together as it relates to getting the baby here. So because we talked about these things, then I know how to navigate my pain. I know how to handle my pain. I know how to see pain as a way of this is not looking at pain in a different way. Like this is my baby and I working together to get her or him here. So looking at things in a different perspective where it will not cause fear. High satisfaction with the birth experience. Once again, relationships is so important. And the stronger and the more effective the relationship with your doula, there is a huge chance or high percentage that the satisfaction will be good. And also improve outcomes for both mother and baby. That is once again our main goal. And it has shown, based upon research, that the benefits of a doula can help with these outcomes. Doulas role after birth. So once the women have delivered the baby, some doulas and I, as myself, what we would do is we would go out and we will assess the situation. You know, we will talk to mom as it relates to the experience. We will do a survey. We will talk about things that we could do different. So it's almost giving me an evaluation or giving doulas an evaluation as it relates to the services during that time period. If the newborn is not latching on, we can help as it relates to breastfeeding support. We can provide emotional support to prevent postpartum depression. But as for myself, I have experience in both. Just to, I can provide emotional support, but I also can assess for postpartum due to the fact that I'm a mental health clinician. And like I said, a lot of people that are doulas may not have that credential, but they may have the resources in order for you to receive additional help if you need it as it relates to postpartum depression, anxiety. There's so many diagnoses that can go hand in hand with this process. We also offer resources and referrals for mental and physical health. We will have resources as it relates to different types of nurse management connections, breastfeeding, lactation connections. There may be times where you need some sort of financial assistance. Some doulas have as it relates to support and resources regarding so many things as it relates to ensuring holistically that you receive what you need at the birth. Checking in with the family members, seeing how they are. So once again, the main goal is to support the family's transition into parenthood. And that can be a very difficult transition because this is a role that you haven't had before, or you have had before, but it's additional kids. So the transition can be very, very great. So that's why it's very, very important that we have support. Now, the benefit of postpartum doulas, usually they come in after the birth doulas leave, but they help reduce the risk of postpartum depression and anxiety. So, with that being said, a lot of moms during this time period, family members may have left. Um, Partners may have went back to work, so they're stuck with this new baby, and they're like, "Oh, what am I going to do?" So a postpartum doula can come in to help as it relates to working upon that mental. They also can help as it relates to supporting breastfeeding, which at times can be difficult. They help the new parents feel more confident in caring for the baby. So they're to ease the recovery process after birth. And so with postpartum doulas, they are there much longer than the birth doulas. And their main job, once again, is to help you with additional support after delivery. Now, that time period for the postpartum doula to be there, that will be something that you and your postpartum doula can help out. Work out. Doula support and maternal mental health. That is my goal. That is my job at the company that I work for called Journeys Counseling Center. I work with the mind. So I address mental concerns as it relates to women in the postpartum stage. But also I do it before women get pregnant, during the pregnancy, and after. This is very, very important. Your mind and your mental plays a huge role as it relates to who you are. So, as a postpartum mental health or postpartum maternal health clinician, or just a maternal health clinician in general, I'm able to recognize early signs of perinatal mood disorders. And perinatal mood disorders could be depression, anxiety, bipolar. There could be some concerns regarding psychosis. So there are many mental health disorders that are contributed or attached to the perinatal period. So I am able to recognize those signs. And birthing professionals, along with doulas, they may recognize that something may not be going on in the correct manner, so they are able to connect you with resources. And that's what the last line said: connect families to appropriate mental health resources. And this is very, very important as it relates to moms and families receiving mental health support during this time period. Evidence shows that if we're able to have support and resources early on, it reduces a lot of interventions as it relates to the mom and the family may receive from medical professionals if there are things that we talk about beforehand or we work on early on so that a lot of additional interventions are not needed. It also improved maternal and infant health outcomes because if you're dealing with depression after pregnancy, then you may not feel as if you're able to take care of the baby. And then the baby have concerns or do not have the connections or the bonding that is needed during the early period of their life because of mental health concerns. That is why, once again, a doula support is very, very important. Doulas and postpartum doulas. And doula support, once again, is linked to lower rates of postpartum and depression. Recent statistics show approximately 6 to 10% of expected mothers in the U.S. engage the services of doula. We would like that number to be so much higher. So that's why we are educating you on the importance of assessing doula services. It is just so important. And also said women who receive doula care have 52.9% lower odds of cesarean delivery. Research showed the earlier and the more involved, or just having a doula in general, research shows that the statistical data is lower for cesarean delivery. Now, there is another thing we want to talk about as it relates to a doula versus a midwife. This is very, very important. Doulas, like myself, and postpartum doulas, we focus on emotional, physical, and informational support. Emotional, mind; physical, we focus on different types of techniques to prepare you for the birth. And we focus on informational support. So we focus on informational support that you can use to provide resources, but we also provide informational support to help you understand the entire process as it relates to preparation for birth regarding doula and doula services. And that's what I'm doing now. Now, midwives, they are medical professionals. So these people, midwives, they have a medical background. And that medical background that provides care for prenatal, labor, and postpartum. So When it comes to doulas, we are not supposed to do anything as it relates to the medical necessity regarding birth and delivery. So we cannot deliver babies. Midwives can do that. Midwives are licensed professionals that have went to school to receive the certification to provide the medicine and the process of delivering. They do that. Doulas do not do that. We provide emotional support. We provide physical support. When I say physical, that means back rubbing or different types of things to help you prepare for delivery, but no medical support. And a good thing is that both doulas and midwives can be a part of your birthing experience. So if that's something that you want, that is something that you can advocate for yourself. Okay. When it comes to choosing the right doula, this is very, very important. Once again, as I said earlier, you will like a doula that you have a relationship with. Why? Because relationships are very, very important. If you do not feel as if you and your doula is a good fit, if you know this now, then that means that you should not have that person in the delivery room with you. Because mentally, if you don't feel it's a good fit, you're not going to trust them. You're not going to have a relationship with them to allow you to have a healthy and a more effectively delivery. Because if your mind is said, I don't trust this person, then you're already coming into this space where you're guarded. And when you're guarded, at times your body stiffs up or it dries up. And what does that do? That can affect the delivery process because that's a sense of stress. So you want to make sure, once again, that you interview your doulas, make sure that it's a good fit. And if it's not, that's okay. You keep looking. But you also want to look for certification and experience. As it relates to myself, I have many certifications, but I also have experience. So that helps as it relates to ensuring to you that I might be a good fit. Now, there are doulas that are in training. And if they are, then once again, you want to look at additional things that they can bring to the table that you have a connection with, where you and that person can work together. You can also ask for recommendations and testimonials. That is okay. Once again, we work for you. So you have the right to ask for the information. Also, you want to ensure that it is a good fit, a good personality fit, and shared values. Look at you can ask us what are our values and beliefs? What are some things that we like to do? All that information is very helpful as you try to connect with the person that, once again, that's going to be with you in the most vulnerable and important part of your life. And also consider the specific needs. You want to make sure that there are certain needs that you may feel important, that you may feel you need. You need to make sure that if that doula can provide it. And if that doula cannot provide it, then ask them if they have another recommendation. Once again, this is your experience. So you want to make sure that you have a lot of say so as it relates to who you choose to be with you during this time period. Now, why does every birth deserves a doula? Once again, it's invaluable support. Invaluable support that can happen in the labor and postpartum, but we also want you to have memories from this. We want you to have happy memories as much as possible. I have worked with women in the past where their delivery was so traumatic. And at this present time, they are in work to work through that trauma as it relates to the experience. Also, as we said earlier, it it leads to better outcomes for individuals and families. That's our ultimate goal. Well, that's my ultimate goal, and that's most doulas' ultimate goal is to make sure or to ensure that we do all we can to make sure you have these outcomes. And also investing in a doula is investing in positive experience and postpartum, positive birth and postpartum experience. So we're hoping that we can have this positive experience and or good experience all the way through. Now, once again, as I said before, things happen. Things happen during the birth process, things that we cannot control. But if you have someone there that can support you through this, it is able to you're able to navigate through it much better with support. Okay, who pays for doulas? Now, this subject is kind of complicated, so I'm gonna try my best. There are some insurance companies now that pay for doula services. So if you have insurance, make sure that you check with your insurance companies to see if they do pay for doulas. If they don't pay for doulas, then most doulas will have like payment options for you. So that will be something that you can work out hand in hand with your doula or with your doula. So once again, this is very, very important that we figure out who will be responsible for payment as it relates to doula services. That will call for you to reach out to your insurance company. And also, you want to communicate with the doulas because doulas will have to be on an insurance panel or on your insurance panel in order for them to receive payment. But doulas at times do have payment options as it relates to receiving services. If you have any questions or concerns as it relates to this workshop, or if you want to reach out to me, you can. We have information at at the end of the slide, or you will receive information at the workshop that you're at today, at the training you're at today, where they will have information as it relates to you contacting me. And if I do not have the answers, I will provide you the information. My name is Sharina Smith, and you can go to my website, sharinasmith.com, SHIRENASMITH.com, or you can email me at admin@sharinasmith.com, or you can call me at 336-355-6918. You can follow me on my Facebook page at Sharina Smith, SHIRENASMITHJCE Services. So those are ways that you can get in contact with me. And this is the information also that you can use. So you can take a picture of this information so you can have as it relates to how you can contact me. And these are the references that I utilized today for this workshop recording. And thank you so much. I really, really appreciate you for joining me. And there are resources on our website as it relates to different places where you can find out information regarding pregnancy and birth. This is one of the this is one of the workshop one of the links, Americans Pregnancy Association. And on the website there will be information as it relates to if you're looking for a doula with partners that we have connected with as it relates to that service. Thank you so much and have a good day.